Recovering from cardiac surgery is one of the most important phases in a patient's journey because while the operation may successfully correct a blockage, repair a valve, or improve blood flow to the heart, the long-term success of that surgery depends greatly on how well the body heals afterward and how carefully patients care for themselves during the weeks and months that follow. And many people assume that once surgery is completed the problem is completely solved, but the truth is that recovery is a gradual process involving physical healing, emotional adjustment, lifestyle correction, medication management, and rebuilding confidence in daily life. And in this detailed discussion, Dr. Aliasgar Bahrainwala explains 5 essential ways to care for your health after cardiac surgery so you can support healing safely, reduce complications, strengthen your heart, and improve long-term quality of life. Beginning with the first and perhaps most important aspect of recovery, which is following medications and medical advice consistently, because after cardiac surgery patients are usually prescribed medicines to control blood pressure, reduce strain on the heart, prevent blood clots, stabilize heart rhythm, manage cholesterol, reduce inflammation and support circulation, and skipping medications, changing doses independently, or stopping treatment early can significantly increase the risk of complications including infections, irregular heartbeat, high blood pressure, fluid retention, or future cardiac events, which is why maintaining discipline with medications and attending regular follow-up appointments is absolutely essential during recovery, and many patients feel better after a few weeks and mistakenly believe medicines are no longer necessary, but healing inside the body continues for months after surgery and requires ongoing support and monitoring by healthcare professionals. And the second essential aspect of recovery is adopting a heart-healthy diet. Because nutrition directly affects inflammation, circulation, blood pressure, cholesterol levels, wound healing, energy levels, and overall recovery speed. And after surgery the body needs balanced nutrition rich in protein, vitamins, minerals, healthy fats, fiber, and antioxidants to repair tissues and support cardiovascular health, while processed foods, excessive salt, sugary beverages, fried foods, and unhealthy fats can slow healing and place unnecessary stress on the recovering heart. And patients are often encouraged to eat fresh vegetables, fruits, lean proteins, whole grains, nuts, seeds, and healthy fats while maintaining proper hydration and avoiding overeating, because maintaining a healthy weight after surgery also helps reduce strain on the heart and improves long-term outcomes. And another extremely important factor during recovery is gradual physical activity and cardiac rehabilitation, because movement helps restore strength, improve circulation, prevent stiffness, reduce blood clot risk, improve lung function, and rebuild confidence after surgery. And many patients initially fear movement because they worry activity may harm the heart, but guided physical rehabilitation actually plays a major role in improving recovery and long-term cardiovascular fitness. And simple activities like walking, breathing exercises, stretching, and gradually increasing daily movement can help the body regain stamina safely, while cardiac rehabilitation programs supervised by healthcare professionals can provide structured exercise plans tailored to the patient's condition, age, and recovery stage. And patients should always avoid sudden overexertion or lifting heavy weights too early, because the chest and surgical areas require time to heal properly. And one of the most overlooked aspects of recovery is emotional and mental health, because cardiac surgery is not only a physical event but also an emotional experience that can trigger anxiety, fear, stress, irritability, sadness, sleep problems, or feelings of vulnerability. And many patients feel emotionally overwhelmed after surgery because they suddenly become more aware of their mortality, physical limitations, and dependence on others during recovery, while caregivers also experience stress and emotional exhaustion, which is why emotional support, reassurance, family encouragement, stress reduction techniques, and open communication are extremely important during the healing process. And practices such as meditation, prayer, light social interaction, relaxation exercises, counseling, and maintaining positive routines can help patients regain emotional stability and confidence gradually over time. And another essential component of recovery is monitoring warning signs and attending follow-up care, because even after successful surgery patients must remain alert for symptoms that could indicate complications such as fever, wound redness, unusual swelling, chest pain, palpitations, Severe breathlessness, dizziness, sudden fatigue or fluid buildup, and early medical attention for these symptoms can prevent more serious complications from developing, while regular follow-up appointments allow doctors to monitor healing progress, medication response, blood pressure, heart rhythm, cholesterol, and overall cardiovascular function, ensuring that recovery stays on the right path. And beyond these 5 major areas, there are several lifestyle principles that greatly influence long-term heart health after surgery, including maintaining proper sleep because the body heals most efficiently during restful sleep, and patients recovering from cardiac surgery often experience sleep disturbances due to discomfort, anxiety, or medication effects, making it important to establish calm bedtime routines, avoid caffeine late in the day, and create a comfortable sleep environment. And smoking cessation is another absolutely critical factor because smoking severely damages blood vessels, reduces oxygen delivery, increases clot risk, and can rapidly reverse many benefits achieved through surgery, while excessive alcohol intake can worsen blood pressure, interfere with medications, and strain the recovering cardiovascular system. And stress management also becomes extremely important because chronic stress hormones increase heart workload and may negatively affect blood pressure and healing. And many patients underestimate how much emotional stress can influence physical recovery, which is why maintaining a calm environment and balanced daily routine can significantly improve overall well-being. And family support plays a powerful role in successful recovery because patients recovering in encouraging, positive, and emotionally supportive environments are often more motivated to follow healthy routines, maintain medications, attend rehabilitation sessions, and remain optimistic about their progress. And caregivers should also remember to care for their own emotional and physical health because burnout can affect their ability to provide consistent support. And one important misconception patients often have is expecting recovery to happen immediately, when in reality healing after cardiac surgery occurs gradually over several weeks and months, and some days may feel better than others, which is completely normal as the body adjusts and regains strength over time. And comparing one's recovery to someone else's can create unnecessary anxiety because every patient heals differently depending on age, overall health, type of surgery, diabetes status, lung function, lifestyle habits, and emotional resilience. And patients should focus instead on steady progress, realistic goals, and consistent healthy habits, because long-term success after cardiac surgery depends not only on the surgeon or the operation itself but also on the patient's daily commitment to protecting the heart moving forward. And the encouraging reality is that many patients who adopt healthy lifestyles after surgery go on to live active, productive, and fulfilling lives for many years, often feeling healthier and more energetic than before the procedure because they finally begin prioritizing their heart health properly. And ultimately, cardiac surgery should be viewed not as the end of a journey but as the beginning of a second chance to care for the body more consciously, improve lifestyle choices, strengthen emotional well-being, and create healthier daily habits that support the heart for the long term, because every positive decision made during recovery, from taking medications correctly to walking regularly, eating better, sleeping properly, managing stress, and attending follow-up appointments, contributes toward a safer, stronger, and healthier future for both the heart and overall quality of life.